Load a 5 milliliter syringe with Chloracid, 3% sodium hypochlorite, and place a 31 gauge Navi tip with double side port on that syringe. In addition to the convenient 30 milliliter indispense, Ultradent's high quality irrigants, Chloracid, Liquid EDTA, and Conceptus are now available in economic 480 milliliter bottles. This tip's small size allows for delivery into intricate canal spaces, while the closed end and double side ports minimize the risk of expressing the sodium hypochlorite beyond the apex. Begin irrigation by completely filling the canal with Chloracid, being cautious not to express any irrigant beyond the apex. The canal should be properly lubricated by placing a small amount of Fialese to make instrumentation easier. From the indispense containers, fill a 1.2 milliliter syringe with a small amount of Fialese and place a 30 gauge Navi tip on the syringe. Fialese is considered a universal lubricant because it can be used in conjunction with any obturation method. Other common lubricants on the market contain peroxides, making them unsuitable for use with resin-based canal sealers. Place a small amount into the orifice of the canal. Notice the effervescent reaction when the Fialese mixes with the sodium hypochlorite. This aids in the cleaning of the canals. You are now ready to begin instrumentation of the middle third of the canal. Once you have finished instrumenting the middle third of the canal, evacuate the canal with a capillary tip and a Luer vacuum adapter. Now fill the canal with Chloracid once again. It is not necessary to use more Fialese because it is usually needed more to begin instrumentation. Chloracid will provide enough lubrication to finish the procedure. Using the gentle watch winding motion, take the number 20 stainless steel hand file to working length. The shaping file and the hand file are crucial steps for removing interferences in the middle third of the canal and creating a glide path for the safe use of the NiTi transitional files. Evacuate the canal and fill it with fresh Chloracid. Constant exchange of the irrigants will help remove dentinal mud and other debris from the canal. Repeated doses of Chloracid will help to break down all organic matter within the canal. Use a gentle, pecking crown down motion to gradually transition the file through the apical third. It is not necessary to reach full working length with this file. Simply take it to the point of resistance and then stop. This file can also be used in a gentle sweeping lateral motion if greater taper is required. Evacuate the canal and refill with Chloracid. NiTi is the alloy used in this portion of the procedure because it possesses the flexibility that is often required to negotiate curves and reach the apical portion of the canal, especially with larger diameter files. At this point, you will have enlarged the canal to a number 25.04 taper. Now that the instrumentation is finished, a final irrigation procedure will complete the cleaning and preparation of the canal for obturation. Load a 1.2 milliliter syringe with liquid EDTA 18% from the indispense syringe and attach a 30 gauge Navi tip. Next, load a 1.2 milliliter syringe with Conceptus, 2% chlorhexidine gluconate, and attach a 30 gauge Navi tip. Fill the canal with the liquid EDTA 18% and allow this to soak for 30 to 60 seconds. Where Chloracid is ideal for removing organic matter from the canal, liquid EDTA will break down inorganic matter such as the smear layer and expose the dentinal tubules. Evacuate the canal. Now fill the canal with Conceptus, chlorhexidine gluconate. Allow this to soak for 5 minutes. Studies have shown that a 5-minute soak with chlorhexidine will provide up to 10 weeks of antimicrobial protection in the canal. Evacuate one last time with the Luer vacuum adapter to remove the Conceptus from the canal and blot out the canals using 1 to 2 paper points. Because we will be sealing the canal with EndoRes, it is not necessary to desiccate the canal. Leaving the canal slightly damp will provide the best environment for EndoRes to penetrate into the tubules. Ultradent's endodontic products solve everyday endodontic problems, giving you the ability to treat most endodontic cases with simplicity.